There may be a time when you have to treat a patient having an asthma attack who either does not have their inhaler with them or the inhaler is empty. In these cases where a replacement is not available, you would need to take other measures to control the attack before help arrives. The first thing to do is to see if you can locate a replacement medication, or maybe send someone else for it if this is possible, as the inhaler is the best treatment. Find out if there are any other medications their doctor has prescribed for them to control their asthma. Also make sure you call the EMS, as this advice will only help them to control their breathing until the inhaler and professional help arrives. The general advice is to first stop what they are doing, just concentrate on treating the asthma and sit them upright, as bending over or laying down can constrict the breathing even more. They will feel more comfortable if they're sat up, but it may find other positions to help them. Get them to take long, deep breaths, which can slow down the breathing and prevent them from hyperventilating, which will make the attack worse. Breathing through their nose and out through their mouth also helps. Breathing out through the mouth slowly keeps the airway open for longer. Moving the person into a steamy atmosphere, such as in a bathroom with the shower on, can increase the humidity in the air, and this may help. Keeping them calm is very important, and although this may not be easy, do your best to calm the situation and take worry and stress away from them. Stress causes the chest muscles to tighten, which can make breathing more difficult. If possible, remove the person from the trigger that causes their asthma. It may be their trigger is dust or smoke, so move them to a place where the air is clear. Taking them into an air-conditioned office may help them. Sometimes hot caffeinated drinks can help opening their airways, giving them some relief for an hour or two. This advice can help them in the short term, but you must get professional help as soon as possible. It may be that the person has their inhaler but is not working effectively, so there are a few things you can do to ensure that the inhaler is ready every time it's needed. Ensure that the inhaler is always kept clean and that the cover has always been put back to avoid dust and dirt getting inside. Inhaling dust or dirt will make the situation worse. You should also ensure that if a spacer is used, it's kept clean and dry. Also change the mouthpiece when needed or every few months. Ensure the inhaler actually has the drug inside and then you're not just breathing the propellant. Make sure that you have a spare canister is carried with you when the level's low. Make sure the latest prescription is collected from the chemist. Make sure a spare inhaler is carried if you're going away on holiday or on a work trip. If you work in a school that holds inhalers, ensure the correct documentation is kept there and make sure that there are sufficient inhalers for the number of children in your care. Make sure the correct inhaler is used at the right time. Using a preventative inhaler in an emergency will not have the same effect as the correct inhaler. Ensure the inhaler is used correctly. Sometimes children blow instead of breathing in, and make sure that the subsequent doses are delivered at the right times. Finally, ensure that the inhaler is in date, as the medication may not be as effective if it's past its expiry date, or the propellant may not deliver the correct amount of drug.